Welcome to Medicare School Daily. We're excited to be with you here today. We're going to be talking about pre-authorizations, which basically is a big word that means your doctor doesn't really get to decide if you are able to get a medical service on Medicare. It's up to an insurance company or maybe an algorithm. So today we're going to be kind of doing a dive into those different plan options and how they utilize pre-authorizations and whether or not the service that you need to get is either denied or delayed. But before we do that, I just want to introduce myself. My name is Josh Music. This is my dad, Marvin Music. We run a company called MedicareSchool.com. We're excited to be with you here today. Basically, our focus is this. We like to educate people about Medicare, and then we've got a team of people outside this studio that if you ever need help enrolling in a Medicare Advantage plan, a supplemental plan, a drug plan, a dental plan, whatever it is, we are a team of insurance brokers that are here to help you do that. And so we talk a lot about Medicare and the pitfalls and how to avoid mistakes and how to lower your cost. But just know if you ever need that one-on-one personalized help, we are here. If you want to be on today's show, there's a phone number that is along the bottom of the screen. You can call that number. We'll take your calls live, answer your questions. It can be anything Medicare related, Social Security related, retirement related. We'll do our best to answer those questions. We've been doing this for about 15 years now. And so while we don't know everything, there's probably not much of a situation that we haven't seen. And so we'd love to answer your questions. Call that number on the bottom of the screen, and they'll kind of walk you through it and then get you live on the show answering your questions. So let's hop into pre-authorizations, the different plan types, and how each of them kind of are affected with pre-authorizations. Thanks.
All right. Very good. Well, it is good to have you with us today. Excited to take your questions. Really, if you're curious about anything, we'd be delighted to give our input and try to give you some direction about your situation, or really whatever is going on with your life in Medicare. I know people are at different stages, and so we are familiar with most of those stages, so we can probably give some help. Let's talk about pre-authorization. First of all, Medicare began in 1965, and then when it was approved, and then initiated in 1966. And so for about 40 years, there was rarely a pre-authorization. And the reason for that is because Medicare covers things that are medically necessary. There really is no question, hardly at all. The doctor says you need something and it's within the list of things that Medicare believes is medically necessary, then it was covered. Medicare would pay, supplemental plans, of course, would pay. And so pre-authorizations in the Medicare system have never really been an issue until 2003. And that's when the Medicare Advantage plans were introduced. And for some reason that I'm really not honestly positive about, the government decided that they were going to give these private health insurance companies the pre-authorization right with healthcare services. And so, of course, Medicare Advantage plans are all about profit. They are a replacement for Medicare. It's an alternative to original Medicare. And so when they started those plans, these companies were given the right to make a certain margin, 15% basically. So their medical loss ratio had to be around 85%. And so part of them making a profit is they said, well, we have to control what kinds of services that people are getting, meaning we have to make sure that they actually need that service. And so they began to restrict some of the services, and they allowed the primary care physicians to be the gatekeepers, meaning that in order for someone to be able to get a certain service, they may have to have a referral from their primary care physician. And then with certain services that were expensive, the insurance company became the gatekeeper, and the insurance company had this right to delay services, to deny services. And so now we have this conflict between a doctor saying, this is what my patient needs, and an insurance company says, well, we don't agree with that. And so that's what pre-authorizations are all about. This is the insurance company having the right to make the final decision, and if they don't agree with the doctor, then they are not going to cover those services. Now, you can still get it, but you're going to have to pay for it. And certainly people do not want to do that. So when we think about pre-authorizations, it is very commonplace now within the Medicare Advantage system. So doctor recommends, then paperwork has to be submitted to the Advantage company for approval. And again, they are certainly going to approve things, but sometimes they don't. Sometimes they want additional documentation so that pre-authorization is actually delayed. Other times they just simply don't agree. They'll say, no, we're not going to cover that knee replacement right now. We believe that therapy is in store first for 9 months. Once you've gone through that process of therapy, then we will allow you to get the knee replacement. I've had clients that were needing full hip replacements. The insurance company didn't agree with a full hip replacement, but they did say we will pay for a rod. And that's all they were able to get, not a full hip as the doctor was recommending. And so the point is that when you give a private health insurance company that really has profit motive this right to be able to have that final say so, sometimes it will be delayed and sometimes it will be denied. Now, if you never experienced this, you won't even be aware of it, like it's a problem. But when you have to go through this process and then get a denial, and the only option you have is then to appeal it, then it can take time. And in fact, what's interesting about appeals today is that I think about 70% of all appeals get overturned.
Yeah.
So the question is, why didn't they just approve that the first time? Anyways, they definitely can be problematic. And so what happens then, as we compare the pre-authorizations in the Medicare Advantage world to the original Medicare world and supplemental world, they're almost non-existent. Original Medicare rarely will have a pre-authorization. There are a few. In fact, there's right now, there's 19 new ones that are being test piloted in 6 different states. It's called the Wiser model.
What states are those?
I can't tell you. I know Oklahoma's one of them. State of Washington's one of them. But
Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington.
Okay, very good. So say them one more time.
Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington.
Okay, very good.
It's the Wiser model, yeah.
So the Wiser model was a way to identify certain procedures that were really abused by doctors.
Wiser stands for the Wasteful and Inappropriate Service Reduction.
Yeah. So they started that. Of course, it just started this year, and it's going to be a 5-year pilot program in these 6 different states. But I've gone through the whole list of the Wiser pre-authorizations. You look at those, and you'd say, well, that makes sense. What was happening? There were doctors that were abusing these, and you have to forgive me, my earpiece is messed up. But anyway, so doctors were abusing it, so they just simply said, hey, we want you to get a pre-approval on these procedures. Now, the interesting about this model is that the doctors really don't even have to get a pre-authorization. Yeah. They can go ahead and do the surgery, they can do what they believe is right, and then submit for payment. Now, if they want to make sure they're going to get paid, then they go through the pre-authorization. So it's really not even apples to apples. Okay. But again, we're going to have about
a 5-year test. So,
and 6 states, and again, about 19 different procedures. My point is, in the original Medicare and supplemental plans, you're really going to see one. In the Medicare Advantage plans, you will. About 27% of the services have to be pre-approved. And so the point is, as we talk about your different options, that's something that you have to decide as a consumer. How do you want your Medicare to work? What do you like? What do you don't like? And so as people are educated about the reality of pre-authorizations, sometimes that causes them to maybe even want to avoid an Advantage plan because of that. Doesn't mean Advantage plans are bad, but they come with that extra hoop that people have to jump through that can be very annoying.
Yeah. Okay. Sounds good. Let's get to the phones. We got some callers waiting, so we're ready. Hello, welcome to Medicare School Daily. What is your name and where are you from? We're happy to have you.
My name is Cheryl, and
Cheryl.
I'm from Michigan.
Cheryl from Michigan. Welcome. What's going on?
Yeah. Well, I'm with the supplemental plan G, which I love.
Sure.
It's gotten too expensive for me.
Okay.
It went up from $152 to $188 or something. I'm on a fixed income. So question is, I'm looking to have surgery on my spine maybe later this year.
Okay.
Maybe this summer. So I've heard about the special needs program with chronic illnesses. Mm-hmm. So what they're talking to me about is maybe going with that, the special needs for the chronic illnesses,
Okay, and who's talking to you about that?
A guy named Aaron from Carrie Cross. And so what I don't want to happen is I change over to the Advantage plan and then find out that they're not going to cover my surgery.
Oh, yeah. Okay, who's Aaron from?
He just called me Friday.
Okay.
And there was a guy named Aaron that I spoke to with you guys like a year or so ago.
Oh, okay.
So I don't know if that's the same Aaron or
I don't know. I don't know. So Aaron's saying to save you money, you should consider a special needs plan. Is that kind of the deal?
Yeah.
Okay, and then
I've been in the hospital twice in 225.
Okay.
I was in 222 with my heart.
Okay.
Congestive heart failure.
Okay.
And I have severe scoliosis.
Okay.
So he was saying that maybe that program might work for me to help save some money.
Yeah.
Well,
what's your zip code, Cheryl?
48503.
48503. Okay.
All right. Well, while Josh looks that up, Cheryl, it may save you money. I am so sorry. It may save you money on a monthly basis, but it's not going to save you money over the long haul. It just isn't, because I like special needs plans. I'm not saying he's giving you bad advice, but if we're just going to look at a monthly budget, that is true. But if you've had some hospitalizations, you're getting ready for a surgery, then the likelihood of you spending more money out of pocket is really high. So it's a good possibility that you're going to incur quite a few more expenses.
What's the plan that he was suggesting, the special needs plan? What was the carrier?
He said that whoever did the surgery would have to accept Zing.
Zing?
Yeah.
Okay, that's a very unpopular plan. Let's look at Zing Health. So they do have a special needs plan. Let me just look at these real quick.
Okay.
And it's probably because you have congestive heart failure, which means you qualify for a special needs plan.
Okay.
Give me just a second here. The problem is if you go to that, you will never be able to get back to that Plan G again, right?
Okay.
And then you may have to jump through a bunch of hoops to try to get some sort of a surgery. Yeah, incline, impossible to continue if we have this echo.
Okay.
Yeah.
Okay, so I should probably stay where I am.
Yeah, you know what? I know it went up $30 a month. That's $360 a year. But the amount of extra liability and problems would just be a lot. Okay, I think we've got our echo fixed. So what other questions do you have, Cheryl, about this in particular that come to mind?
I just wanted to know, would that be good for me to do, to go in the chronic special needs, because I am going to the doctor's office quite regularly.
Do you qualify for Medicaid by any chance? Probably not.
Yes, I do. I have limited Medicaid.
Okay.
But it was just based on my income.
Mm-hmm.
And they sent me a notice saying that maybe if I would try to apply for Medicaid, not through my income, but through my illness, because they say that it is a difference. So I'm going to
and who is they that sent you that letter?
State
Department of Social Service.
Okay.
Mm-hmm. Cheryl, I think sometimes when you speak to an agent and you say you want to save money, they naturally, of course, want to try to help you do that. And so, as I was saying earlier, it is true you would save money monthly premium, but by the time you have this operation, by the time you may have another hospitalization, I promise you're not going to save any money. That plan that we saw that you're looking at, I think the out of pocket expense was a little over $4,000. I think it was $4,250. So it's very possible that you could max out on that. So that's $2,000 more than what you're going to pay in your premium for your supplemental plan G all year long. Okay.
Oh, okay.
Yeah. So that's monthly savings only, not long term for sure. And what's sad about these plans is once you get on them, Cheryl, and you stay on them more than a year, you can never get off of them without medically qualifying. And of course, with your heart issues, you'll never qualify. So then, what happens in 5 years down the road if these max out of pockets are $7,000 or $8,000 or $10,000? Then you're in a real bind. So I think the risk of your max out of pockets raising more than what your monthly premiums are going to be it's higher. I think it's a higher risk with the Medicare Advantage.
Okay.
Now, if you said, Marvin, there's no way I can afford it, I just cannot. Well, then you have no option. You just have to pay as you go. And
I would just be careful. Call into if you really do need to make a switch. Whoever's pushing Zing is a plan that came out and they've tried to be popular for about a decade now, and they just don't have a lot of members in their plans, and they're constantly pretty much shrinking. Your experience may be great, no idea, but they're not a very strong offering. I would say there's probably better options than perhaps someone who's just trying to push Zing on you. Mm-hmm. Okay. So there's 68 different Medicare Advantage plans in your county, and Zing probably isn't the top option for you. So. Okay. All right. So probably stick with where you are unless it truly is just out of control, out of your ability, and then give us a call.
And special needs plans are good.
Yeah.
They are good, but knowing what you have in your future, even this year with this, did you say it's spine surgery?
Yes.
Yeah, I was going to say that's serious. And the rehab that's involved with that, plus you're going to have networks that I guarantee are going to be very, very restricted. Yep. So your options for providers, hospitals, surgeons, docs, all those kind of things, Cheryl, you're going to be in a cage with that. You just are. And we're not disparaging Zing as a company. That's not my point. My point is right now you truly have Cadillac insurance.
With what's coming up, it just seems like if you can figure out a way to afford it, it would make a lot of sense.
It sure would. All right. Well, we appreciate the opportunity to talk to you, Cheryl.
Take care.
Okay. Thank you.
Bye-bye. Yeah. Hello. Welcome to Medicare School Daily. This is Josh Music. Marvin Music's here as well. What's your name and where are you calling from?
And my name is Jolisa.
Nice to talk with you.
I'm calling from Florida.
Florida. Excellent.
Yeah.
What can we do for you today?
Okay, so my husband's turning 65 this month.
Okay.
And so we were discussing Medicare and the supplemental plans because I do not agree with the Medicare Advantage plans. I don't like them.
Okay,
so,
can you tell me why?
Well, I work with seniors, and when they have the Advantage plans and they fall and break a hip and they go to the hospital and then they go to rehab, there's problems.
Sure. What are those problems? This is curious. I'm just curious because you obviously have frontline experience.
You have to fight for the 100 days.
Okay, fight for the 100 days. Sure.
Some of them just say we only have 60 per year. And it's like they need more than 60 days of rehab.
Sure. That's not very much. I mean, really.
They just and they send them back home, and then they fall again. So I'm like, no, we're not going to fight with this. We're going with Medicare where you get your 100 days. If you continue to, you're not going downhill, you're maintaining or getting better. So I was looking at his, and my husband has, he doesn't go to the doctor very often. He's pretty healthy, maybe twice a year for prescriptions if they make him come every 6 months for his thyroid medicine. Okay. So I was looking at the Part G high deductible, the Plan G high deductible.
Okay.
And I was wondering, there's 3 plans, Plan G high deductible, Plan G, and Plan N.
And there you go.
And I was trying to figure out, I think the high deductible will be the better way to go with him than the other 2, but I'm not sure.
Sure.
Okay. Well, is Jolisa, is that correct?
Yes.
Okay, very good. Well, I'm not a huge fan of high deductible Gs. I do not think that they are terrible, but one of the issues with a high G is that if you stay on that, with most companies, more than 6 months, in order to get off of it, you're going to have to medically qualify to get to a G or an N in the future. So the way the high Gs work is Medicare, of course, they'll pay still. And then whatever the balance of the bills are, all those bills up to that deductible, which this year I think is about $3,000, is going to come to your mailbox. So you're going to be liable for $3,000. I know you're saying he's healthy, and you may not even reach that, and that could be true. But the issue is, if, let's say, 7, 8, 9, 10 months down the road or 2 years down the road, he has some kind of an issue where you do meet that deductible and you continue to meet that deductible, then now he can't get off of that, because you have to medically qualify in most states. Now, you're in Florida, so you definitely have to there, but in most states you have to medically qualify to move to another plan. And so, most people try to save money when they're healthy, and then they're planning, well, I'll switch, to a plan that's going to give me better coverage down the road. But the problem is, down the road comes much sooner than they had planned, and now they're stuck. And so that could happen to you. And so if I were you, if I were looking at something budget friendly, I would look at the N. Because I think it's still pretty attractive. And of course, Florida, the bottom line is it's a state that's a little bit higher than most states in the country. I happen to live in Missouri, and we also are a high state like Florida for the same reason, because everything has to be issue age. And so that's what drives that's what tries to price up higher. If it was attained age, it would be substantially lower. But you can't change that. But if you say there's just no way that we can afford that, or we want to afford that, then go with your high G. I would just encourage you, though, I wouldn't roll the dice too long. I've been in this business for a long time, and I see people roll the dice too long. They love saving the money, and then all of a sudden, boom, something happens, and now they're stuck, and they can't move again. So that's our 2 cents. Again, I'm not saying high Gs are bad, but if you don't have an opportunity to be able to get off of that very easily, and that's the case in most states, then that underwriting process could be real difficult down the road.
Yeah,
that's all.
It's kind of the same logic. I feel like that people, to your point about not liking Advantage plans. Number one, I think you're very wise. Yeah, I loved hearing that. I mean, it's unfortunate, but I love hearing that kind of frontline sort of a story about the Advantage plans. Thank you for sharing that. But people, they're like, hey, man, I'll just get an Advantage plan for a couple years, and then, then I'll switch to a supplement plan. And all that sounds fine and good, except for the fact that usually people want to switch their insurance when something's going wrong. Yeah. And when it comes to supplemental plans, it's too late, right? And so that you could end up in the same sort of a scenario, like, hey, high deductible worked great. Few years, something changed in his health, you try to switch, and by then it's just too late. It's kind of like, I always use the analogy, it's kind of like waiting to get homeowners insurance until the bathroom's on fire. It's just too late. And so I think that would be our caution and our concern. Do you guys by chance have like a big HSA? Because that is one option. Like whenever people have a pretty substantial HSA, sometimes that makes sense to go that high deductible route. Because you already have dollars set aside to pay those? Okay.
What was the premium difference between that high G and the N in Florida?
It was, I didn't look at his N, because they change it every year, but mine is 183. I have the N. Mine was 183, and the high G his is 53.
Okay. So you're going to save about $130. About $130 a month. So you're going to save about $1,500 in the year, and you're now obligated for that high deductible versus just the Part B deductible. So again, we all have to live within our means. So Jaleesa, we're not saying it's a crazy idea, but I'm very healthy. I took a G plan. because I know that could change. Now, in my area, just so you know, in Missouri, there wasn't a big difference between the G and the N, just like $30, $35. Some states there's $50, $60, $70 more. So we love the N's. We think it's a very, very good option. So, anyways, well, that's our 2 cents. You all have to decide. We're all different. We all have different deductibles in our cars, our houses, and so really, at the end of the day, it's whatever you all are comfortable with.
What other questions may you have?
Nothing really.
Anything?
I mean, I deal with this every day.
Yeah, you sound like an expert.
Yeah,
that's for sure.
Are you a physical
not that much.
therapist? Or do you work in a physical therapy?
No, no. I'm an elder care coordinator.
I see. Okay. Wow, you do see it a lot. Yeah. Okay.
Yeah, we do see it, and so it's like, okay. So what do you have? What I always say is, what insurance do you have? Is it a Advantage plan? Well, no, it's my husband's retirement from, let's say, Massachusetts.
Yeah.
And I go, really? And it's they've got Medicare. We got Medicare, but we've got the secondary is theirs. Well, the secondary is really a managed care plan or an Advantage plan.
Advantage plan.
Yeah, that's how almost all retiree plans are like that for sure. And it's the same hoops.
Really,
yeah. Well, the government took on the responsibility instead of the company taking the risk. That's how that works.
Yep.
So, yeah. All righty. Well, it was sure good talking to you.
Okay.
Yes. You have a good rest of your day.
Take care.
Yes.
Thanks.
Okay.
Bye-bye. Hey, if we can help you, call into our office. We'd love to kind of help you compare some of those options. We've got a team of people that are here to do that. So.
Okay.
Take care.
You.
Thanks. Bye-bye.
Take care.
Bye-bye.
Okay, let's take one of the questions from our YouTube channel. So if you are watching us on YouTube, follow us on YouTube, you can go into the comment section, leave comments. We will answer every single question that you put in those comments. So let's answer this one. Plan G sounds great. The question I have that wasn't mentioned is how much does it cost? I just started on Medicare in December 2025 and went with a no-cost Advantage plan in addition to Parts A and B, because I'm in good health and take no prescription drugs. It seems that if I went to Plan G, I would be paying monthly for a benefit I may not use. You want to speak to that?
Sure. Well, I am 65. I have owned my own home now for about 45 years. I've never had my home burned down, ever. But I'm going to keep homeowners insurance just in case. All right. And so my view is, it is true. You can look in the mirror and say you're healthy right now, but that can change very quickly. In fact, I'll never forget, Josh. That's when our company's just grown through the years. Is when one of our original offices that we had in Overland Park, and I was had a couple, husband and wife came in. I mean, very good shape, retired school teachers, excited about the future, what they were going to do with traveling plans, and literally 6 months later. He wants to see me, and I go out to the lobby, and he was truly the most yellow person I've ever seen. And
liver?
he had liver cancer. He died not long after that. So within 6 months, here's a couple that getting ready to retire, enjoy their life, and had good retirement from teachers and all that. And of course, he's dead. She's still our client. But my point is, you just never know. And so I just encourage people, you can't look in the mirror today. You just can't. You have to realize that things happen. In fact, I know for a fact that 1.2 million people this year that are on Medicare will be diagnosed with cancer. 1.2 million.
Wow.
Yeah. So that happens. In fact, 70% of all people that get cancer diagnosis in our country today are 65 plus. So the point is, things happen, and so it's wise to be thinking ahead. I have homeowners insurance just in case my home burns down. I have auto policy in case I have a wreck. And so this is the kind of insurance we don't want to use. But it's weird about health. We look at it and say, well, I'm probably not going to need this. But we don't see that about auto policies. We don't see that about homeowners. And yet probably this is a greater risk, for health concerns than even the other. And so none of us would even think about dropping or having inadequate homeowners insurance or auto insurance. But sometimes we do with health just because we see the mirror today.
Not to say that the Advantage plan isn't insurance, but I think the logic that you're trying to go of is like, hey, I may not never use this Plan G or Plan N supplement. Well,
Yeah. Well, she's asking,
as we get older, also we probably will.
Yeah, we're saying, but I'm paying for a benefit that I may not use. Yeah, you may not use. I pay for homeowners insurance. I probably will not use it, but I still have it anyways. And so people just have to decide what kind of risk they're comfortable with. And another thing about this, the Advantage plan. I watch them. We do a lot of studying, and we're seeing these networks decrease and decrease and decrease. Yeah. Why? Because the reimbursement rates are so low. Our last caller talking about the issues with home health right now, and these different care issues that people have to deal with their Advantage plans. They are becoming more and more restrictive.
Yeah, and I think the other thing that is worth mentioning is you started in December of 2025 on Medicare. So maybe you realize this, maybe you don't, but a lot of people don't realize that you have a once-in-a-lifetime right to get a Medicare supplemental plan, right? And that begins on your Part B effective date, right? So take, if you started December 25, go up 6 months, what is that, May? And you've got to get your Medicare supplement plan in place by then. If not, you've got to medically qualify. And so this is a decision with some time urgency, with some deadlines. Not to say that you wouldn't be able to qualify down the road, but you may not. And a lot of people, they end up waiting, thinking, well, I'll just change when something happens, and by then it's too late.
Right,
okay, let's do another question here. For Plan N, this is, again, somebody on our YouTube channel. For Plan N, is urgent care a doctor visit or an emergency room?
Okay. Yeah, urgent care should not be a regular doctor visit, that there would be a copay responsibility. Certainly not. The emergency room on the end is going to be a $50 copay if they're not admitted to the hospital. It'd be waived if you go to the hospital. But I do not believe that urgent care visits would apply to the $20 copay. I do not. They're actually going to a physical doctor's office, not urgent care type situation.
Okay, let's do another one. This is a Social Security question. Ex-hubby is 3 years younger than me. If I get to 67, full retirement. If he files for Social Security at 62, can I get half of his full retirement?
Okay, so here's the way it works with ex-hubby. As long as you were married 10 years or longer, and you did not remarry personally before the age of 60, then you could be eligible. Now, you're saying if he files for Social Security at 62, yes. Actually, what happens once he gets to 62, as long as you all have been divorced more than 2 years, he does not even have to be taking for you to take. If you've been divorced less than 2 years, then yes, he has to be taking before you take your own Social Security. It's called an independent spouse. And they define that as someone that's been divorced over 2 years. So my point is that the divorce is less than 2 years, then that spouse has to take Social Security benefits before you can take. But if it's over that, then the only thing that matters then would be age. He does have to be 62 for you to draw that benefit. That's the way it works. Okay. Yeah, it's called an independent spouse. Okay. So can I get half of it?
Let's say they've been.
I'm not quite done. So then, as far as half of his full retirement, that would be true. There would be no penalty for you. Your spousal benefits can be based upon his full retirement age amount. So that's going to be correct. But here's the issue: if your 100% of yours is greater than 50% of his full retirement age, then you have to take your own. Okay, that's the rules. So it is true, you can get it, but I'm just saying to you, we have what's called the deeming provision. So when you apply, they make you take the greatest amount. And again, 50% of his may be more than 100% of yours. If it is, then you can get that full amount with no penalty. Go ahead. I didn't mean to cut you off
that's it. So let's answer the question. If I get to 67, if he files for Social Security at 62, can she get half of his full retirement?
And she can, as long as they've been divorced more than 2 years.
Okay.
And
There
exactly
you go.
right. You sure can. Yep. Yeah.
Awesome.
If he takes, she can take immediately.
Okay, if it's under 2 years.
Exactly.
If it's over 2 years, then
that's right.
just whatever.
He can't keep her from getting that if the divorce is over 2.
I didn't know that. Okay, let's get to the phones. We've got another caller lined up. Welcome to Medicare School Daily. This is Josh Music. What is your name and where are you calling from?
My name is Marty. I'm calling from Logan, Utah.
Logan, Utah.
All right, Marty, good to have you on the program today. What kind of question do you have, sir?
Well, I'm a federal retiree,
Okay.
and I brought my FEHB along with me, and I'm also a 70% disabled veteran.
Okay.
I get primarily for me, I use the VA for my health needs, but I have my spouse, my wife. I have the FEHB I carried over, but it's getting so expensive for that. I'm just wondering if it's a better deal to suspend my FEHB and kind of go with a supplemental plan for her while I kind of stay on my use my VA, and if I needed to just have like a Medicare Advantage plan for myself.
Sure.
That's kind of where I'm at.
Okay, let me. So you brought your wife into it. So is she also retired?
No, she's not.
Okay, she's still working. Is she? Oh, go ahead.
No, she's been. We have 7 kids, and she's been a stay-at-home mom. You know, our entire marriage.
Mm-hmm.
So I'm getting ready to go on Social Security because I'll be 69, and she'll hit her FRA in May, and so like in July we're going to start taking Social Security.
Okay, that's good. I understand. So how much is your FEHB premium right now? What are you paying
About
for it?
About $650 a month.
Okay, a month. All right.
That's just for both of you, or just for her?
For both.
Okay.
Yeah, it's for both of us. Yeah.
Okay. So, Marty, are you enrolled in A and B right now, or just A only?
A and B.
Oh, you do have A and B. Okay, that sounds good.
Yeah.
Okay. And how old is
and my
your
wife? My wife has A and B too.
Oh, she does have A and B?
Okay.
Is that okay? All right, that sounds good. Okay, well, first off, let me clarify something, and I'm not trying to be nitpicky here at all. But if you did get a supplemental plan, you would not be suspending FEHB. You would actually be terminating FEHB. And so at that price, I wouldn't bother me a bit to terminate FEHB. That's definitely no bargain for you whatsoever. That's not a good value. So you're already enrolled in A and B, which I think is very good. What I would do is go ahead and terminate FEHB. Or let me say it this way. This is what I would at least look at if I were you. And then if you terminate FEHB, you mentioned something about her a sup and you an advantage. So are you saying that because you're healthy, she's not? Or why would you say that?
Well, because I primarily, almost exclusively use VA because I'm 70%.
Okay, very good.
70%.
And you're comfortable with that system. Okay, very good. That makes sense then. I wanted to make sure I understood. All right, so what I would do with her, I would look at A and B, and I would either look at a G plan or an N plan in Utah. Okay? And do you know the difference between G and N?
Mostly there's some premium charges for the N, and G is more friendly.
Vice versa. No, the G plan is the most comprehensive coverage. It covers everything but the B deductible. Okay, so it covers 5 of the 6. That's what I have. So a person has a G plan is out of pocket their premium, and after that they just meet a small B deductible once a year. That deductible is $283. Right. Okay, the N plan is going to be about. Josh can run here. What's your zip code, Marty? What's your zip?
84318.
84318. Josh will run it real quickly, and we can kind of see the variance. But usually in most states, the N plan is going to be about maybe $50, $60 a month less expensive. And so the N's a very, very good option. The difference between N and G is that N, like the G, will not cover the B deductible.
What's the month and year of birth?
What's your wife's month and year of birth?
July 1959.
1959. Okay, very good. And put household discount in there. You're not multi-policy. Anyway, so the N plan, what happens is you have a little bit, you have a couple copays on the N plan. When you go to the doctor, you could be subject to a copay of up to $20. And again, that's after you've met your deductible. So that's the same. G and the N, both you have to meet the deductible. So the N plan has a $20 copay to see a doctor, and has a $50 copay to go to the emergency room. And then one more thing that N will not pay is what's called excess charges. And this is when a doctor adds to the bill. It's very, very rare. Statistically, probably maybe 3% of the time, so it doesn't happen often. I don't want to say it never happens because it can happen, but again, it's not a huge risk. But that's the difference between G and N. So N, you're responsible for excess, and you have some doctor visits, could be up to a $20 copay. The emergency room would be a $50 copay. All right. So for me, that's what I look at both of those, and you all just have to decide on your budget. But it's going to be much more friendly than the $650. So I think your thinking is correct. Now let me tell you what to do. You got a price?
Yeah, I was just going. So the plan in rate that he was just describing for your wife ranges anywhere from about $85 a month up to about $130. So depending on the carrier.
Okay. So. Okay,
yeah, so call it 100, 110. I mean, just there's kind of a range there.
How about G plans?
Plan G, 125 to 170.
Okay, very good. So pretty competitive rates in Utah. Those are good rates. But let's just say, let's call it, we went with the end plan. Let's call it $100. Okay. Now with that end plan, your wife is going to have a prescription drug plan. And pardon me.
Yes.
Yeah, and so does she take very many medications?
Yeah, she's got about 5 or 6, but they're all tier 1.
Okay, real cheap, generic. Okay, Josh looked it up.
For one of them.
Okay.
What is that one?
One of them. The Mounjaro.
Okay.
Okay.
Is she taking it for weight loss, or is she taking it for diabetes?
Yes.
For weight loss?
For weight.
Okay. Yeah, I don't know that it's going to be covered by Medicare for weight loss anyways.
Yeah, I mean, I think there's ways they kind of
they do work the system.
That.
Okay, yeah. I didn't know that. So anyways, but here's the bottom line, Marty. Even with that medication, the most anyone would spend on a drug plan, as long as it's in formulary, for the whole year is $2,100. That's the most.
Right.
Yeah. So so even worst case scenario, that's what you're looking at, and Josh can see if that would be covered.
Yeah. Okay. So that the cheapest or probably the right drug plan, without knowing all of her meds, but just that one is probably about a $10 a month drug plan.
So we're talking $10 a month for a drug plan. We said $85 to $130 on an in, so we called it $100. So we're looking at $110 a month for her. Okay, and then for you, what I would do for sure, if you're happy with the VA, I would enroll in what's called a Medicare Advantage only plan, MA only plan. And the way, are you familiar with those?
Yes, because since I get all my drugs from the VA anyway,
that's right. That's exactly right. And then you'll get a decent give back. And we'll help you with all this. But average right now is about $120 to $150 a month on your Part B premium. Medicare Advantage company does have to cover your meds. So what they'll do in lieu of that is they'll give you a credit towards your Part B, and you'll see that, of course, reflected in your Social Security check going up. And that's what I would do. And then the beauty is you still have at least a civilian option. If you didn't want to use the VA, you still have your MA, which is your inpatient, outpatient site for medical. So to me, that makes all the sense in the world. Stop the $650 bleeding. You're not getting hardly anything out of it anyways. Put your wife on a good G or N plan. And I think it's win-win all the way through, sir. I really do. And then, get your meds to the VA, and you still get some of the perks that come with the Advantage plan. And so we write all those. If you're looking for a broker, we'd love to serve you, help you. There's no cost, to use our services. And we actually can send you a text. Josh, is that right?
Yeah.
Okay, we can send you a text, and then if you want to respond to that, talk to one of our agents, and we'll help you. And we'll be delighted to make sure that we shop all those plans for her, including the drug plan, and then look at those Medicare Advantage only plans for you in your zip code.
Yeah, that'd be great.
Okay.
I'd love it.
Yeah. We'll send you a text. You can respond to it and be our client. And hey, we have our own customer service team too. That's one of the neat things about MedicareSchool.com. Josh and I started this company 17 years ago now, and we said we're going to make sure that we service our people. Don't just write a plan and say, "See you later. Have a great life. Good luck." We don't do that. We have a team that helps people. When you have problems and things happen, our insurance is flawed. So when things come up, you can always call us, and we'll be here for you.
Great. I will be more than happy to talk to one of your your customer assistants.
Okay. Well, we'll send you a text. You'll be able to respond to it and get on the counter. Go ahead.
You have any other questions, kind of top of mind that have bubbled up?
The only thing I wanted to ask is, you said to terminate, because my understanding is if I terminate my FEHB, I can't get it back again. But if I suspend it and something happens, I can roll it back and start using it again.
And that is true. That is true. But here's what happens. With on the form, you can pull it up. It's terminating FEHB. It's an OPM form. And what happens is the option for your wife's coverage for a supplemental plan, it says you do have to terminate. Now, if you want to just you check the box that says suspend, that would be fine. Go ahead. I can show you.
Here.
Yeah. It's option C. I am suspending my FEHB benefits for the purpose of taking an Advantage plan. Okay, so you can do C, but I'm saying for her though, if you put her on a SUP, that one is option B. So look, what's the form number, son?
It's OPM. Let's see, hang on. I think it's RI, like Rhode Island, 79-9.
Yeah, that's the form, and you can look at it there. It's real clear on there.
So for her, so what you're saying is then canceling hers and suspending his, so he can always go back.
Yeah, well, and you're the one who worked for the government, right? Yeah.
Yes.
So yeah. Well, I think you're probably fine if you do it this way. And let me tell you why. Because you're covered. So if you suspend, you're really suspending both of your benefits, and then enroll her then into a that supplemental plan may be just fine because you were the worker. So I would try that. Well, the bottom line, what I want you to stop the bleeding on the 650. So I think that's gonna work if you just do your option C. I think that will work. I'm just saying if both of you are going SUPs, I know we couldn't do that. You'd have to terminate. So
and for her, a supplemental plan for my wife is better than an Advantage plan, right?
Well, maybe. I mean, there are a lot of people that are happy with their Advantage plans. I don't know how much of our program you listen to, but with Advantage plans, they're fine insurance, but there's a couple issues that you just have to be comfortable with. They're going to have networks. You could encounter a pre-authorization, of course. About 27% of the time people have pre-authorizations. But that doesn't make them bad. So if you feel more comfortable with that and put her on an Advantage plan, then especially since if you just suspend, then that's probably the cleanest way to do that. Put her on an Advantage plan also. And then if you all decide you're no longer happy with that system, you just come back into FHB.
Oh, right. Yeah.
Okay.
But with her, she has to also answer medical questions, right, and pass those.
Not right now. Pardon me?
Supplemental plan.
Well, now she would not have to at all because you all would be losing employer coverage. So really, what you may want to do is try that Advantage plan. You can try it up to a year.
Yeah.
So that may not be a bad option.
Because then you'd be saving. You basically have no premium, right?
Yeah. You can find a zero premium plan in your area. And if she's healthy, then that would not be an issue. You're in a very unique situation. Most people cannot do what you're doing, because you have this FEHB in your back pocket. And if you suspend it then, and then both of you took Advantage plans, then that may make sense.
Yeah, and then you always have the options of going back to FEHB.
Yeah,
right?
That's right. Because you just suspended. Right. That's right.
Okay.
Yeah, and the agent you talk with knows everything that we just shared with you.
All right, I will get back with your agent.
Okay.
Move forward.
Yes, sir, Marty.
Thank you.
We appreciate you calling in. Good to talk to you, sir.
Thank you. I appreciate your time.
Yeah,
have a good day,
Take
sir.
care.
Bye.
Quick question from the YouTube channel. I have been told if you don't get your annual wellness checkup, Medicare will cancel you. That's not true.
Yeah, that's not true at all. Yeah, they don't. That just doesn't happen.
Yeah. You're good. You don't have to go to the doctor.
Yeah, exactly right. So no. Now what happens sometimes? Medicare Advantage plans they try to do these home visits to keep their star ratings up.
Yeah.
So they may put some pressure on people for that.
You're not going to get canceled though if you don't go to the doctor.
No, not at all.
Okay, let's go to our next caller. Welcome to Medicare School Daily. What is your name and where are you calling from?
I am Richard. I'm calling from Omaha, Nebraska.
Richard from Omaha, Nebraska. Welcome. Thanks for calling. What can we do for you, sir?
Is this Marvin?
This is Marvin and my son Josh. We're both.
Josh, all right.
Yeah, we're both on here with you today.
All right, Marvin. I love your name. My dad's dad name was Marvin Hans.
All right.
Very good.
Hey,
Once I seen Marvin, I was.
Now, I was going to say, how long you lived in Omaha?
I was born in Omaha, Nebraska.
Is that
primarily raised in Council Bluffs, Iowa?
Okay.
Like the Hatfield and McCoys.
Yeah.
You
Well,
know anything about that?
yes, I do. Well, good to have you on our show today. So, how can we help?
All right. Okay, now the Medicare. I turned the 65 age over now, and I found out I had Medicare, and I always had third parties helping me out with things because they had me convinced of other things about myself. Well, now I want to learn on my own self because I've learned I've had benefits, not as much as others, more than some. And so I'm wanting to find out. I have a straight up Medicare right now that I'm eligible for, and I have called Part B.
Mm-hmm.
Now there's a Part A that's getting in there where it has what's called premiums to be paid for.
Mm-hmm. Yes, sir.
Or I could buy my own premium for a certain amount, which I don't know how much time that would be, and have Part B. Or I could do what my goal is. Plan up and get and pay a little more taxes and get that paid up in them quarters.
Mm-hmm.
Okay.
So you don't have quite enough quarters to have Part A for free?
No, I have 38 of them.
Oh,
but see, I want to have more than 38, 40. 40 of them just a minimum.
Well, but
That's enough.
You don't need 41.
Hey, 40 gets you the same thing as 140 gets you. It doesn't
Yeah, I
matter.
know, but I want to. Yeah, I understand. I still, for some reason, want to pay in.
Yeah, well, you can. Hey, Richard, what's
much as
your
I can.
date of birth, sir? What's your birth date? Okay, very good. Okay, so right now, have you been paying for your Part A? I know right now it's $311 a month. So have you been paying that?
Well, see, now I speak with some of the branch offices off of the SSA,
Yes, sir.
the Social Security Administration, and the Medicare.
Uh-huh.
I'm just ready to go to Baltimore with it because they vary with me. That's where this supplemental comes in called Medicaid. I shut that clear off. I finally figured that Medicaid business out. Okay, in the branches of them, how they insure. Anyway, I won't go into that with you.
Yeah, but that Medicaid was probably paying your Part A premium, weren't they?
Yeah, but man, I had other benefits coming that I didn't know how to do.
Okay.
And I was wondering where they were going.
Okay. Well, let's go back and talk about.
Do you have a red, white, and blue Medicare card?
I do.
Does it show Part A and Part B as having a coverage effective date?
It just has Part B because I've checked into that. You helped me with that. Jonathan Cook did.
Oh, okay.
One of your representatives, someone of your
So you got Part B,
yeah.
but you don't got Part A.
Because they have 40 quarters.
Yeah.
And Medicaid would pay the Part A premium.
Yeah.
Okay, so let's go back to your quarters. So what I would do, this year, you basically have to make about $4,000 is all you have to make to pick up those 2 quarters for this year. Have you made that much so far in 2026?
No, but man, I could do it.
Well, you should, and then make sure you pay your
along the way.
Okay, you all you need, it's the quarters this year, $1,890. So let's call it $4,000. And once you made $4,000, what you need to do is you want to have your pay stubs, and you can actually get those to the local Social Security office because these things they take about a year to report normally. But when you can expedite the reporting by submitting documentation that you've made that, and they'll bring you up to those 40 quarters, and then you'll get your Part A at 0. And you can keep working, you can make more money, you can keep pay taxes no problem, but 40 will do it.
Will he get awarded that automatically once that gets filed, or will he need to go to the Social Security office and say, I want Part A too?
No, yeah, well, exactly right.
Okay.
He'll have to tell
I'm just
them.
trying to think of steps. So first make $4,000.
Right. Have receipt of that. Proof of that.
Receipt.
Pay
Get
stub.
those pay stubs. Take it to the Social Security office. Right.
That's right. Now, is that self-employment $4,000, or would that be you be working for someone earning money in there as an employee?
Being my own business, I got talents now.
Okay, that sounds good. So
I've got so good at faceting gems, I can take diamonds and make pretty gems out of them.
Okay, good. Well, then what you need to do
I've been giving them away, and people said I was crazy about giving them away.
Can I get your address? You can give me some diamonds.
Yeah. Okay, but hear me out now. Hear me out.
I was giving them away, believe it or not. I didn't even know I had them.
Okay.
I was buying them at such a price. I've met a lot of good people along the way. Finally, they cut me off. They said, no, you got to stop this because they keep saying you can make money. And I was blowing shit out. I just wanted to give away a stone. Well, now I know how to do that.
Okay.
I also know how to make dollars off of it.
Okay, so you got to make 4,000 of those dollars,
and you have to pay taxes on that. You need to report that income, so you need to pay quarterly estimates. So what I would do is, let me tell you what I would do. As soon as I've made that money, I would pay a quarterly estimate of $4,000 and get some taxes paid in there. And you only have to have 6.2 times 12.90 and 12. I'll tell you what you have to do. 12.90 and then 12.40 and 2.9. So I think it's 15.3. Yeah. That's right. So what you would want to do is you would want to you need to have $4,000 worth of income. Let's say, and you're going to have to pay 15.30% as an estimated tax amount,
which is $625.
You're paying. It's basically $110, I think, for the whole year.
Okay.
Yeah, it's very little, very very little. Yeah. So you could pick those quarters up very quickly.
So pay that, and then
you pay that, and then once that's in, then you would call your Social Security office locally and let them know that you want to enroll in Medicare Part A premium free, and you keep all your records because they're gonna want you, even though you think they'd have it, you want to have those records because they're going to see that you paid those taxes.
Now, can I do this year, and what time, or do I have to do it quarterly?
Yeah, will he have a problem enrolling in Part A?
Quarterly, I can set it quarterly.
Yeah, you can do it.
But I want to go this year and keep it. I'll have a place for what you're saying.
Good.
And I'll just let it build up there. And then once the end of the year's up, you tell me when my time limit is.
You don't even have to wait. You don't have to
immediately.
You don't have to wait.
Yeah, but I want to show them that I did something.
Well, I understand that,
I want to show them that I can be independent, man, because I know I can. I've been dependent on these third parties and stuff.
Okay, well, you need to have that $4,000 of net self-employment income, okay, and then you're going to pay taxes on that, and have somebody that in your area that is either an accountant or just anybody that can help you with that. And then you're going to call your Social Security office. And what I would do, just call the office anyways and say, hey, I'm gone back to work. I'm 2 quarters shy. How do I report to you my net self-employment income? And they'll tell you the process they want you to follow. And then after that, you're ready to enroll in some other kind of Medicare type plan if you want. Yeah. Let me ask you a quick question. On your Part B, I know you said you had a card. So what was your effective date on your Medicare Part B?
Okay, here it is. This year. Okay. I mean, it's supposed to be effective last year, from what I understand.
I know. What's the date?
Third party again.
I know. What's the date?
All right, let me get it out. I'm getting it out.
Okay, good.
I'm not speaking to Marvin. I'm speaking with Josh.
No, you're speaking to Marvin. Josh is right here by me.
You're speaking to the man.
Marvin's voice.
We're both
Josh,
in the studio.
Okay, I'm distinguishing the voices right now.
Okay.
01-01-2. Okay, 1/1. 2025.
Okay, that sounds good.
Coverage starts right there.
Okay, very good. So how are you paying for that, Richard? Richard, how are you paying for your Part B premium? Because right now that Part B premium is $202.90 a month. So how are you paying for that?
I guess it's coming right out of the check.
Okay.
Somehow, I don't know. Okay. That's what I mean. This is all I'm learning.
Okay,
I'm learning all this.
That's
right
fine.
Now.
I'm assuming then you have some type of Social Security disability. Is that you qualify for?
Yes, it's a disability.
Okay,
and
good.
That's another Q on it.
Okay, and that's fine.
Never could figure out what the disability is.
Okay, well, I don't know for sure, but maybe you said you had Medicaid, so they may have put all that together. So that $202.90 is coming out of your check. So, boy, you are so close to having my friend. Let's get that $4,000 of net self-employment income reported to the local office. Make an estimated tax payment to them. It doesn't have to be much. I promise you, it's minimal. Yeah, and then you're going to tell them I want to start my Medicare Part A for free. They'll give you a new card. You'll have an A date, a B date. And then you can call us back, and we'll help you to get maybe either an Advantage plan or a supplemental plan. Probably a supplemental plan. Probably Advantage plan may work best for you with your money being a little bit tight.
Okay, yep, the Advantage, all right.
Yep, yeah, and we'd be happy to help you with that. So, well, I'll tell you what I'm going to do if you don't mind. I'm going to have, because we got to take another caller here. I'm going to have our producer send you a link, and you'll be able to go on that link and actually set an appointment up, and we'll help you with all this. Okay?
Okay, here's what I need you to do.
Yes, sir.
If you could send it over this phone I got, because for some reason I can't get data very well anymore. I'm going to have to get another phone and another phone number. I'll update you with that. Only certain people I'll give that phone number to.
Okay.
You know what I mean? And
I know
you're
what you mean.
one of them.
All right, that'd be good.
Yeah,
Hey, we count a privilege to help you, sir. So we'll send that link to you right now to this phone number that you've called in on, and then we'll go from there. Let us know how we can help. Okay.
Well, guys, thank you for tuning in to today's episode. We'll be back here tomorrow. Guys, if you want to call into the show to ask your questions, whether it's Social Security or Medicare related, that number is 823-824-2004. We're here every single day, Monday to Thursday, from 11 o'clock Central Time to noon to answer your questions, do a little Medicare teaching. We appreciate the opportunity to be with you today. Talk soon.
All right. Take care.